You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, welcome to the Veterinary Rehabilitation Podcast. I'm your host, Dr. Megan Kelly, and today I chat to Elizabeth Broussard. She is a vet, and we chat about how she integrates traditional Chinese medicine with Western veterinary medicine. Having both studied veterinary acupuncture, one doing traditional Chinese acupuncture and myself having been trained in Western scientific acupuncture, it was really interesting to discuss the different ways in which we approach our cases. She also uses food therapy in her practice, and I think this is going to be a great topic for another podcast. So over to Elizabeth. Welcome, Elizabeth. Thank you so much for joining me.
Thanks for having me, Megan.
Elizabeth, you are actually here in Cape Town with me, which is so awesome because usually when I am doing these podcasts, it's with somebody from another place in the world, and we're always troubled with time zones. So it's wonderful to have somebody right here in Cape Town, and we actually should be doing this in person. But I know that you're really, really busy, and I appreciate that you're taking the time to chat to me. So we are online. I wanted to ask you just how you got to come to Cape Town and just about your journey as a vet from veterinary into doing traditional Chinese medicine.
Well, I am in Cape Town as an import. My husband's South African. We met while we were both living in the Cayman Islands many years ago. So we stayed there for a while, but decided we wanted to come to South Africa and raise our son here. And we've really enjoyed being here. I graduated in 2001 from veterinary school in Louisiana in the United States, and started actually acupuncture as a elective course in vet school then, and really was interested and intrigued with the different way of looking at medicine. But obviously in vet school, you're really being pumped with a lot of information in Western medicine. So it was something that I put on the back burner for several years. And then in 2006, I ended up jumping back into it head first.
Yeah, I mean, it's such a different way of looking at our cases. So, from normal vet school and how we were taught, it's all about treating the symptoms. Whereas, with traditional Chinese medicine, we have a completely different approach, don't we?
Yeah, we do. And it's, it starts out by the way that we look at the patients and the way that we do our initial diagnostics, whereas in Western medicine, we take our histories, we do our physical exam, start talking about the symptoms immediately, our diagnostics that we want to run, and it sort of fits through a very stringent diagnostic pattern. Whereas in Chinese medicine, we watch the way they walk in through the door. We do a lot of that history taking, but the history is so different. It's not just about the symptoms. It's about where in the house the dog likes to lie. Do they lie in the sun? Do they seek shade? Personality traits, which corresponds with the 5-element theory of Chinese medicine, and the yin and the yang. That's back to that heat seeking versus cool seeking. And we do weird things like tongue and pulse diagnosis. So it's a very different way of starting to diagnose. So it's definitely something that, as I do an integrative type of medicine, I have to do both of these things at the same time, typically when I see a patient.
Yeah, there must be quite a challenge to combine the two.
It is, but I think that through the years of doing it, it's actually become just the way that I practice, the way that I roll. I mean, I was saying to a friend the other day, when I go to her house and her animals are climbing all over me, I'm not just petting them. I'm actually, my hand slips down to the region where I'm feeling its pulses, and I start, doing massage along the back and feeling for active acupuncture points. So I think it just, when you start to learn, especially Chinese medicine, you really just start to fall into that as your natural way of doing things.
Yeah, I mean, I completely get that as a vet rehab therapist. I literally see a dog and I'm also just watching how it walks, and then I just start palpating, just
Yeah,
palpating along the
yeah,
back to see if I can find any muscle tension areas that I can just immediately start to start treating. So
yeah,
I hear you.
yeah.
So, I mean, when you're looking at an integrative approach, are you using medications, so allopathic medicines as well as herbal medicines? I mean, is there a danger in combining those two? How do you approach those, so the medications and things like that?
Well, with herbs and Western meds, there are a few that would be contraindicated to use together. Um, Many times they're complementary or they're safe to use together, though. But I mean, as any doctor would and should do, you have to look into those things. And even if it's something that I've used a lot of, I will still I would say almost on a daily basis, I'm online, I'm looking to make sure there's no new information, that no one's come out yesterday and said, these two things can't be used together. Having said that, I've actually struggled a bit with using herbs in South Africa, just because I haven't had the same suppliers that I've had when I was in the U.S. and when I was in other countries that would allow me to import some of the ones. Unfortunately, there's a lot of I would say that there's a lot of skepticism about Chinese medicine and herbs and natural therapies like that. And unfortunately, the nutraceuticals and the herbs are not only in South Africa, but in the US and the UK, they're not regulated as strictly as Western medications are. And so it's scary because you have to really make sure that you have good sources for these herbs. And the ones that I've worked with the most, I just can't seem to get here. But I'm trying to open that up a bit for myself. I'm sure that it's just the fact that I haven't been here long enough to find those suppliers yet, or maybe haven't found the ways to get it in yet.
So what you're saying is there's a concern, the brands that you've got, that the quality is not good, that what they say is in the product is not necessarily in the product.
Yeah, I think there was a study done. Not sure when it was, but this was just some little morsel that I picked up when I was doing my studying. It said that about 80% of the nutraceutical products, so that's not just Chinese herbs, but all of your vitamins and supplements and things, that about 80% of them contained less than 20% of what they claimed to contain. And then on top of that, let's say it's a herb, and that is supposed to be something that is going to clear heat. And heat in Chinese medicine might cause a symptom like itchiness. And so what do we use in Western medicine for itchy skin is steroids. So they actually would find some of these herbal formulas were containing steroids. And so, of course, then that's completely not what we're trying to go for. So without having knowledge of all of the reputable sources for herbs, and I would rather keep with a few brands that I really trust, and I know there are some good ones in South Africa. I just haven't found all of the formulas that I like to use within that range, whereas I've had them at my fingertips. In the US, there's a really good company that's actually a veterinary herbal medicine company. They also do it's also one of the schools of Chinese veterinary medicine in the US, and they do their own herbal formulas. And so those are the sorts of sources that I like to use when giving my herbs to my little pet cases, because of course our animals are our children, and geez, I just want to make sure I'm giving them safe herbs.
Yeah, I think that there's no veterinary herbal companies in South Africa. I just think the market's maybe not big enough. But hopefully you can source them and maybe get some product out from the States to here. Elizabeth, let's chat a little bit about the different types of acupunctures. So I studied Western scientific acupuncture. which is very different to the traditional Chinese approach. And interestingly, when I had my practice, I actually had another vet that worked with me, and she had studied traditional Chinese acupuncture. And so what was really interesting for me was to look to see the points in which she used and I used when we'd seen some of the cases. So if she had maybe gone away or taken leave, sometimes I would have to see her cases. And interestingly, we used to actually treat with very, very similar points. But the way in which we approach the case and our way of thinking is really different. Can you just explain to us, from a traditional Chinese approach, what the difference is between Western scientific and traditional Chinese?
Sure. So with traditional Chinese medicine, I mean, first of all, I'm going to say all of your points are based upon these patterns that we find. So I'll just kind of touch on that a bit before I tell you how we select the points. So with Chinese medicine, the way that we look at diagnosis is we're looking for patterns of disharmony or imbalance in the body. And there are meridians that run along the body, all over the body, so along the back and down from the axillary region to the fingertips, and the groin to the toes, and the hip to the toes. There's meridians all over the body, and we have to look at several different things. So we're looking at our tongue and pulse diagnosis, and we're trying to consider what the symptoms are in Chinese medicine. If we have pain, sometimes we'll call that stagnation, or qi is stagnant, or So first we find our pattern that we're dealing with. And we also will run our hands along the body, and we're going to feel for areas that might feel cool or feel warm, or when we palpate, your finger sometimes just dips right into a space where there might be that correlates with an acupuncture point. And we call those active points. So once we come up with our diagnosis and we decide that we want to, let's say we want to tonify the qi and bring energy to this animal. And we know that, let's say that it has arthritis, and the bones are in the kidney channel in traditional Chinese medicine. So we might run along the kidney meridian for selection of some of these points. And what we try to do is we try to select points that might be local to the pain or where we think the problem is originating from, but we also want distal points. And what that does is it's pulling energy through the whole body with a focus on the area that is causing the biggest problem. So I think that with Western acupuncture, and you're going to know more about this than I would. I actually don't know much about Western style acupuncture, but I think you kind of more focus on where it hurts, where we'll do that, but we'll also, pull the energies both from and away.
Yeah, so we have the same, where we have points in the area, but we also do treat with distal points. So if you're treating with local points, then within that meridian, you would also use distal points too. So we have this similar type of approach. But the selection of points regarding which meridian is not specific to what that meridian relates to, or the connection. So for us, it's like if it's around the stifle, there are a certain number of points around the stifle, and we use those points basically. So there's no connection between the meridians and why we choose those specific points.
And then the other thing that's very specific as well to the Chinese medicine would be that we might have two patients, both are suffering from degenerative joint disease, but one seeks cool, let's say, and the other seeks warmth. And so in the one that seeks the cool, we'll find points that will be cooling. And then for the one that seeks warmth, we'll find something that's going to be bringing the warmth to them. So, that's why it's more of a really treating of the individual as opposed to just treating the syndrome.
Yeah, and the traditional Chinese approach is more sort of an holistic approach where we're looking at the health of the whole animal, basically,
Right.
like that there are potentially problems that are actually happening internally that might be presenting themselves externally. And I think that the Western scientific approach is very similar to how we were taught at vet school, so very much looking at the symptom and treating that symptom. And I must say for me, it was quite a journey for me. So, I mean, just taking the step from normal veterinary into acupuncture, even though, I went on a Western scientific acupuncture course, I still didn't really believe that it actually worked, So they asked, does anyone here not believe in acupuncture?
I'm still shocked on a daily basis.
Yeah. And I remember them even saying to us, it doesn't really matter if you don't get the point exactly right, like in my mind, like I think I could have understood it really well if you got the exact point, and you stimulated that area, then it was close to like nerves and blood vessels and whatever, you know what I mean? Like I sort of that calculus, and they said, no, but don't worry, like if you're just a little bit out or if you're there, it still works. And that just amazed me. And I think, when you're actually treating animals with acupuncture, like you say, you just get amazed every day because you'll have these animals that are in such pain, and they've been referred to you, and they have had every single drug under the sun, and nothing is working. And they're at this point where they're about to put this animal to sleep, and you treat them with acupuncture, and you just, the next day you phone the client to see how they are, and they're like, I actually can't believe it. My dog went up the stairs for the first time in a year, or something. They like say something like that, and the clients were amazed. And I remember, even after having practiced for years, would still also be amazed, that this treatment actually, we can be so effective in it. And it's not always like that, there's some cases that respond so much better than others. But yeah, it is so amazing, isn't it?
Yeah, it is. But what something else you touched on as well a second ago was just that, we go to treat one thing in Chinese medicine, but sometimes we'll get something else out of it that we weren't expecting. And yesterday, for instance, I saw a dog, a giant schnauzer that's 12 years old. So that's an amazing feat in itself. And I was seeing her for hip dysplasia, and she's just become very weak. But we talked about some of her other symptoms, and her owner said that lately she's been PUPD, drinking and peeing more often, and also just really nervous and barking at the wind and all of this. So anyway, she gave me an update this morning, because I always ask for an update the next day. And she says, two things happened. One of them was that the dog slept through everyone that came and rang the doorbell yesterday, which she said is really unusual. So I felt kind of bad. It's an older woman whose dog is her security. So oops, sorry about that. But she said that for the first time in months and months, she didn't drink her full bowl of water for the day, which is really cool, because that wasn't what we were there to accomplish. And she actually didn't have much to say about whether or not she was moving better, which might come in time, of course. But yeah, it's really cool how Chinese medicine will, it just balances them.
Yeah. I think that's sort of how one part of the body affects another. As a vet rehab therapist, I mean, that's something that we see every day. And that was also a shift for me from traditional veterinary to practicing as a vet rehabber. Certain parts of the body, I mean, just looking at the musculoskeletal system, if you've got a dog that's got hip dysplasia, they're obviously compensating and shifting their weight onto the front, and often, I would get cases that would be referred to me for forelimb lamenesses. And, they did have a fallen lameness, but that was secondary. The primary issue was hip dysplasia or something there. So that connection, between parts of the body, even though, in vet rehabbers, we're mainly looking at musculoskeletal, and we're looking at fascia and muscles and ligaments and soft tissue. There is that connection always, and we need to look at the whole body as a whole. We can't just be treating one area. So they come in with a lameness on the hind leg and we isolate it to the stifle. We can't just focus on that. We got to look at the whole animal. And so one of the things I wanted to chat to you about, in my years of being doing acupuncture and being a vet, it's become a lot more accepted now. And sort of in 2006 here in Cape Town, it really wasn't accepted as a form of treatment. And I think mainly because at vet school, in honest to put, it really wasn't mentioned. I can't actually ever remember having a lecture. Might be that I wasn't at it, but I don't remember much about anything. So anything about acupuncture. I mean, we were taught a little bit about homeopathy and herbal treatments, but nothing specific. Like generally, just like this is the thing, and that's about it. And in the early days, I used to be known as the hocus pocus vet here in Cape Town, and people used to think that I had like crystals and smoke and things like that. And I found it really hard. I remember in the beginning, just my colleagues, my veterinary colleagues, some of them were open to it, but a lot of them weren't. And it used to be really, really difficult for me. Is that something that you've experienced?
I have. I wouldn't say it's been something that has been an overriding issue for me. It might be more because I just haven't given, I don't know, I don't let it affect me much. If people have negative things to say about anything, I sort of try to detach myself a bit from that. I mean, I do remember in vet school having the class, and I mean, I'm from the southern part of the US where everybody's good old boys and they're cowboys, and so that sort of thing absolutely isn't something that's embraced. And I do remember when they were offered the course for us, it was the first year it had been offered, and I remember one of the cowboys saying, "I can't believe they have that going on over here." But through the years, and I've lived in a really interesting place in the Caribbean where that was also sort of a witchcraft sort of thing, and I was burning moxa one day, and that's this herb that we will burn sometimes, and it has a smell that's a little bit similar to marijuana. So we've gotten some eyebrows raised. Now it seems like you say, I totally agree, it's more accepted. I would say there's maybe 50% people, other veterinarians, our colleagues, believe that there are some benefits. I don't think they know much about it. And then the other 50% seem to just try to appease us, and no one's, I really haven't had too much of a pushback. I think that seems to be where things are heading, which is good, and hopefully it will become more and more embraced as more scientific studies are being done, and they are. There's been exponentially increase in the number of studies that are being done to show the benefits of acupuncture, especially acupuncture. I'm not sure of how there are studies being done as well for herbs and for other traditional Chinese medicine, but I think acupuncture has gotten the most as far as people really trying to push for that, and getting good results as well in these studies.
Yeah, I mean, I think that in Cape Town, I think that probably in the last 10 years, things have really changed, even in the rehabilitation world. So, I mean, rehabilitation wasn't really recognized 10 years ago here. So we really have come a long way. So I think that practicing now would be a whole lot easier. But don't get me wrong, I mean, I had a lot of vets that supported me, but there were just one or two that questioned it. And a lot of them are actually converted. So I would end up treating their own dogs or cats. So they would say, they'll give it a try. Their dog is paralyzed, and somebody would say, well, you should take your dog to Megan Kelly, and then they'd give it a try, and then I'd convert them. So, but it took a while. It really did.
Yeah, and I think that's what I've been. I think that was another thing that when we were given the instruction, and it was one of the little analogies that we were told to kind of help to explain to us why acupuncture and traditional Chinese medicine has been practiced almost in the same way as it had started, thousands of years ago, and it's been tweaked through the years, but through history, if something works, something works. And so these practices have remained unchanged because they do seem to work. Whereas in Western medicine, it's continuing to develop. We are changing, ever changing that gold standard and what it is. Yet it's always, in the Western mind, it's the most trusted type of medicine is Western medicine, because it is more based on clinical research and evidence-based medicine, but it is ever changing. And so, it's really interesting how the Chinese medicine, it's kind of you believe it once you see it. And I think that is exactly my experience as well. Those that have been the kind of ho-hum and not so sure about it are the ones that do come around when they see that it actually works.
And often if you have it for yourself, that was when, like I say, when I went to the course, I really didn't believe in acupuncture, but we had to put needles into each other. And that night I had the best night's sleep, like that dog that Schnauzer you were talking about. And I hadn't slept like that in ages because of my back pain. And I had the best night's sleep. And the next day I was like, this works. So you either have to experience it through someone close to you, or your pet itself, or yourself, and most people, I think, will be converted.
Yeah, which is so funny that's how it is, because in Western medicine we just trust. We go to the doctor, we get a pill, and we trust that it's going to work. We know that is what it's supposed to be, and it's funny how that's how our minds work.
Yeah, but if you think about it, I heard a story about in China, they actually pay their doctors to keep them healthy. So you actually pay every month your doctor, and when you're not healthy, then you stop paying. I don't know how true this is, but it's the other way for us. So we pay them when we're sick. So their whole thing is to stay healthy all the time, and that's how they pay their doctor for that, to keep them healthy.
Well, that's exactly though. I don't know how accurate that is with the payment to keep them healthy, but it is exactly how Chinese medicine works, because in Chinese medicine, the reason we haven't touched on this yet, but the Chinese medicine is made up of acupuncture, tuina, which is massage, the herbal medicine, food therapy, and then exercise and meditation. So the acupuncture and the tuina and the herbs are for when you're sick. And the food therapy and the exercise and meditation, that's also for when you're sick too. But that's what you're supposed to be doing on a daily basis to keep yourself healthy. And so, if you are coming to me for Chinese medicine or for integrative medicine, I'm going to try to fix the problem that's going on. But then we're going to use food therapy, and we're going to have different exercises, and even the tuina will be, I see that one as part exercise, because you're doing some range of motion and some manipulation, but it's also a form of meditation. We can't really meditate with our pets. Well, we can meditate, but we're not sure that they are. But when we're sitting with them in our laps and we're massaging them, then that almost puts us both into sync with one another, and I see that as a meditation that we do together with them, and that is in a way making them healthy and keeping them healthy. So it's absolutely how that works.
Elizabeth, thank you so much for taking the time to chat to me. I feel like we're going to have to schedule something else, because I've got so many more questions for you. But I've really enjoyed chatting to you, and we hope to have you back on the podcast to touch on all those other different ways in which we can treat animals with traditional Chinese medicine.
Sounds great, Megan. Thanks for having me.
Vet rehabbers, for more information on how to take your career to the next level, go to www.onlinepethealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.